Hello, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with another new topic, that is cervical cancer. In this class, we are going to discuss what is cervical cancer, what are all the causes and risk factors, clinical manifestations, and then diagnostic evaluations and also treatment. We are going to discuss in this class. We'll see what is cervical cancer now. Here, cervical cancer develops in the lining of the cervix, the lower part of the uterus that enters the vagina. Here, what happens? It's going to it develops in the lining of the cervix, and that is the lower part of the uterus, and then through that it enters the vagina. And then this condition usually develops over time. Here, normal cervical cells may gradually undergo changes to become precancerous and then become cancerous. Here you can see the image, cervical cancer. Here cancerous tissue you can see, and then here cervix, it enters through the vaginal wall. We'll see the types of cervical cancer. Here there are two types. One is squamous cell carcinomas. Here it is going to affect for 80 to 90 percentage, and then second one is the adenocarcinomas. It is going to affect for 10 to 15 percentage. Let's see incidence and prevalence. Here, cervix cancer is the second most common cancer in women worldwide and is a leading cause of cancer related death in women in underdeveloped countries. Worldwide, approximately 5 lakh cases of cervical cancer are diagnosed each year. This is about a statistical database. We'll see the risk factors and causes here. First one is the HPV infection, that is human papilloma infection, virus infection. Here, infection with HPV is the main and very common cause of cervical cancer. And then HPV is a group viruses that can infect the cervix. And then HPV is the cause of nearly all cervical cancers. And then HPV can be transmitted by sexual contact, early sexual contact, and having multiple sexual partner. Here, main cause is human papilloma virus. And then lack of regular pap tests. Here, cervical cancer is more common among women who don't have regular pap tests. And then here, the pap test helps doctors find abnormal cells. Removing or killing the abnormal cells usually prevents cervical cancer. And then comes to the third one, that is smoking. Here, the chemicals in cigarette smoke interact with the cells of the cervix, causing precancerous changes that may over time progress to cancer. This is also one of the important cause for cervical cancer. And then comes to the fourth one. Here, weakened immune system, and then also sexual history. Here, women who have had many sexual partners have a higher risk of developing cervical cancer. And then using birth control pills for a long time, and then having many childrens, and also diethyl stilbestrol. Here it is a drug. Well, see the clinical manifestations here. Cervical cancer does not usually cause pain, although it may in very advanced stages. Here, pain doesn't feel, but we can see the advanced stages here. And then bleeding that occurs between regular menstrual periods, and then bleeding after sexual intercourse, and then bleeding after going through menopause, thin watery vaginal discharge after intercourse, and then pelvic and lower back pain we can see, and then painful sexual intercourse, painful urination, that is dysuria, and then edema of lower extremities, weight loss, anemia, and then vaginal discharge gradually increases and becomes dark and foul smelling. Next, we'll see the diagnostic evaluations. Here, detection and diagnosis. First and foremost, there will be the physical examination, and then a history collection is a must. After that, pelvic examination, pap smear, colposcopy, and then biopsy is needed. Blood test, CT scan, and then cystoscopy and also proctoscopy. These are the mandatory diagnosis for cervical cancer. Here comes to the management, important part of this one topic. Laser surgery. In laser surgery, a narrow beam of intense light is used to kill the cancerous cells, and then the laser destroy these cells, leaving healthy cells in their place. And the next one is the cryosurgery. Here in cryosurgery, liquid nitrogen is circulated through a probe which is applied to cancerous tissue. Freezing temperatures destroy the cancer cells. And then also third one, surgeries. Here we can see radical trachelectomy. That is, the surgeon removes the cervix part of the vagina and the lymph nodes in the cervix. This is a radical trachelectomy. And then comes to the second one, that is total hysterectomy. Here the surgeon removes the cervix and uterus. And then third one is radical hysterectomy. Here the surgeon removes the cervix, some tissue around the cervix, the uterus and part of the vagina. And then also comes to the fourth one. Here radiation therapy can be given, may be used alone or after surgery, or chemotherapy. Okay, we'll see what is here chemotherapy. Chemotherapy uses toxic drugs to destroy cancer cells. I hope you all are very clear with the topic cervical cancer. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.